Nick Watt, thank you so much. We have Dr. David Persse with us now with the Houston Health Department. And Doctor, thank you so much for joining us. You say that you would not reemploy the statewide lockdown. Tell us why.
Well, I don't. There's consequences to that. So I'm glad that the governor took the step that he had today. But we have to balance it, right? Because when you go to lockdown again and people wind up without jobs, then they don't get their medications and there are other healthcare consequences. So it's got to be a very delicate balance. I don't know what the right number is, but I am glad to see what the governor did today.
Okay, so at the beginning of all of this pandemic, we were seeing hospitals in New York running out of ICU beds, ventilators. Are you seeing signs that that could happen anytime soon in Texas?
So we are in really close contact with our medical center, which has most, but not all of the hospitals in Harris County and in Houston. And we've been working very closely with them. And they have plans in place. And for the short foreseeable future, measured in a couple of weeks, they tell us, they assure us that they are going to be able to handle it. But there's another problem that comes with hospitals that really hasn't been a part of the national conversation. And that has to do with how hospitals are paid, that is pitting the elective surgery against the patient who's got COVID disease. And that is a solvable problem, in my opinion.
And how would you solve it?
Well, today, if you're the CEO of a hospital, then you make money, and not a lot, but you make money on the elective surgeries. The profit that you make in that, you use to offset the losses that you incur taking care of a patient with viral pneumonia and or the complications of that. So what America needs today is America needs hospitals to be financially incentivized. And let's face it, they're businesses like anything else. So they need to be financially incentivized to take care of COVID patients and in the winter with influenza patients. But today they're incentivized to take care of elective surgery. So when hospitals are overcrowded and when a pneumonia patient comes into the emergency department and there's no bed upstairs for them to go to, that's because those beds are filled with patients that are elective surgeries, scheduled admissions, because that's what the hospital has to have. So why don't we pay hospitals to take care of the kind of patients that we need American hospitals to care for today, which is your pneumonia patients, along with all those complications? I think that's a fixable problem.
So the last hour, we heard Dr. Anthony Fauci, this was just a very short time ago, pleading with young people to take more precautions. He said that he was seeing people who maybe saw their personal risk on kind of a continuum and that they were behaving appropriately. But he said that everyone here is part of a dynamic and global system, basically. So a young person, if they're infected, he said you're going to pass it on to somebody else. That's how this infection rate works. And you could be passing it on to someone's aunt who has had radiation. You could be passing it on to a child who has leukemia. You could be passing it on to vulnerable people. And he basically said, and you will be doing that. He's tried to say, without blaming, without placing any blame, I am kind of holding you responsible for doing that. Are you seeing young people hospitalized, or what trends are you seeing with young people?
So here in Houston, we're seeing the same trends that the other urban areas across the nation are, that yes, we are seeing the average age of the patient who's admitted to the hospital is getting younger and younger. And that's a twofold thing. One is the virus has absolutely clearly got out into the general public and is spreading amongst people who go out and interact with each other a lot. And as young people, we're much more social than we are as we get into our 40s and 50s. Conversely, the other thing we've done is we've done a pretty good job of protecting those in nursing homes. So we're seeing two things occurring. One is the average age is coming down because of the better job of protecting nursing homes and the elderly themselves who are not nursing home are doing a good job of protecting themselves. Those are the ones that are religiously wearing masks, social distancing, not going to gatherings. Whereas younger folks tend to be the ones, in my observation, to tend to be doing those things that we would rather they didn't. There's nothing evil about a younger person. They just need to understand they have the same level of responsibility as anybody else does.
Yeah. Dr. David Persse, thank you so much. We really appreciate you joining us from Houston, where you are experiencing an uptick there in coronavirus cases. Some 20 million